Stacy. I'm the lead hygienist at Excellent Dental Specialist. I've been here about 8 years. This is the first educational video in a series of videos we will be providing to our patients this year. For most of our patients, it is every 3 months. This is because most of our patients have periodontal disease, health concerns, or dental implants. However, most dental insurance companies will cover a cleaning every 6 months, but there is no evidence scientifically based on why that is recommended. Studies do show that bacteria can return to your mouth every 9 to 11 weeks. So we work to remove this plaque every 3 months, and that is why we recommend it for our patients. A prophy or a simple cleaning are for people who have healthy gums and have not had disease in their mouth or is present. The word prophylaxis literally means action taken to prevent disease. So if the gums are coral pink, firm, don't bleed, there's no recession or signs of attachment loss like recession or pockets, then you may be fine with a prophylaxis or prophy. Healthy gums and bone levels indicate measurements of 1, 2, and 3 millimeters. Once you get a 4 millimeter pocket and beyond, that is recorded when we measure your probing depth. Inflammatory attachment loss, this means there is evidence of periodontal or gum disease and bone loss has begun to occur. Once you have been treated with either scaling or root planing, osteosurgery, LANAP, or gingival flap surgery for bone loss, you will then need to have periodontal maintenance cleanings, which are indicated for every 3 months. Just like being diagnosed with diabetes, you can lose the weight and no longer need the medication, but you will always be a diabetic. The same thing is indicated with periodontal disease. You can become stable with your gums reattaching to the teeth, but the bone loss that has occurred has already happened, and making things stable is why we have the periodontal maintenance cleanings instead of the prophies. Maintaining what was done from surgery along with needing the more thorough cleanings going to the base of the pocket is what periodontal maintenance cleanings are. So this is a question we get a lot. I'm going to show you right here with the Typodont I have and some floss. What you like to get is a floss about as long as your arm. You can get that. I am left-handed, so if you're right-handed, it's going to be a little difficult. So you get your dominant hand, use your middle finger. You're going to wrap up all the floss. You're going to leave about this much or so. Use your non-dominant hand, get the middle finger as well. Wrap about 2 times around. You should have about this far between 2 hands. You're going to go between the teeth. You're going to do a seesaw motion. Go in and out. You don't want to pop it in because then that'll lacerate the gums. Once you slide inward, you're going to create a C against one of the teeth, and you're going to go even further down. So before you come all the way back up, you want to make sure that you slide to the other side of the mouth on the other tooth. You're going to slide back down, seesaw motion, then you're going to come back up, and then you take it out. You want to wrap up the dirty floss on your non-dominant hand and release one strand on your dominant hand so that you can go back into the other teeth with a clean piece of floss. And you want to do the same thing back and forth. Well, there are a lot of reasons why a person's gums will bleed when they have their teeth cleaned. The most likely reason there is bleeding is that their gums are inflamed from the accumulation of plaque and the tartar at or below the gum line. Your body tries to fight off these bacteria. What happens is a signaling mechanism is turned on in our bodies to fight the infection. The blood vessels are dilated, kind of like moving from a garden hose to a fighter fire hose, so as to allow our immune system to try to kill the bacteria near the gum line so they don't enter the body's circulation. So the blood flow to the gums is increased, making them more likely to bleed. So it makes sense that when we are going to remove the plaque or tartar from the areas there is bleeding. The gums are likely in a state of infection at this time, and it causes our gums to swell and bleed and become inflamed. So when removing these debris, it releases the tension that will cause the gums to bleed. This is why it is important to have more frequent cleanings to help minimize the bacteria which may cause you to have bleeding gums or gum disease. One of these reasons could be if you're a mouth breather. In this case, when you have your mouth open for long periods of time while breathing in, you dry your gums out and cause them to swell. Your mouth needs moisture just like your hands. If you do not have the moisture on your hands, they begin to crack and bleed. Same thing goes for your gums when they are being placed in any type of pressure. Dry mouth in general will cause you to have bleeding at times when a cleaning is being done due to no moisture on the gums. There are a variety of things out there that can be purchased over the counter to start with. However, depending on the severity of your dry mouth, it can be vetted out to what is the best option for you. Biotene gel, there's a mouth rinse. This is over the counter. Sprite products. This contains xylitol, which is a natural sugar that helps with not only more saliva flow, but also with the prevention of cavities. Prevident toothpaste for dry mouth. This is only sold in dental practices or is given as a prescription. This too also helps with multiple things like more saliva flow, prevention of decay, sensitivity, and help remineralize or strengthen the teeth. Now, if you have severe dry mouth, having a prescription for either Nutrisal or pilocarpine would be the route to go. To be honest, I really like the hard cases, only because I know when I start my cleaning with them, a lot of people feel hopeless or feel like their mouth is just so horrible. So once I'm done with my cleanings, I can show them afterwards how it looks, and it feels like a work of art to me.